It's great to be here to talk about anxiety and panic attacks. It's important for us to understand the basics before we dive deeper. So, what is anxiety? Well, it's a natural emotion that we all experience to some extent. It's like our body's alert system, preparing us to face challenging situations. For instance, feeling those butterflies in your stomach before an important presentation is normal, right? Now, when anxiety goes beyond healthy limits and starts to interfere with our daily lives, it might be a sign of an anxiety disorder. And panic? Well, that's like a more intense form of anxiety. It's when you feel an overwhelming fear, accompanied by intense physical symptoms like rapid heartbeat, sweating, and shortness of breath. Distinguishing between anxiety and panic attacks is crucial. Anxiety is generally a response to a specific situation, while panic attacks occur without an apparent trigger. For example, feeling anxious before a job interview is understandable. But if I start having a panic attack for no apparent reason, it could indicate a more serious problem. Thus, understanding these differences helps us seek appropriate help and develop strategies to deal with these challenges. I'm Dr. Anxiety, and we'll discuss 5 basic differences between anxiety and panic attacks. Pay close attention to these differences, especially when I talk about difference number 2. These differences could help save your life and the lives of those you love. Help spread this video. Difference 5. Triggers and causes. The causes of anxiety can be diverse and varied, often being a combination of genetic factors, environmental influences, and even life experiences. For instance, if I grew up in an environment where there was a lot of pressure to be perfect, this could contribute to developing more intense anxiety. Moreover, stressful events like job changes, relationship breakups, or financial troubles can also trigger anxiety. Sometimes even insignificant daily occurrences can accumulate and trigger feelings of anxiety. Now, when we talk about panic attacks, the triggers can be somewhat different. While anxiety can develop gradually in response to various situations, a panic attack often seems to come out of nowhere. For example, imagine I'm just relaxing at home, watching TV, and suddenly I start to feel my heart racing, shortness of breath, and an overwhelming sense of fear. There's no obvious cause for this. It's just the body reacting in an intense and unpredictable way. It's important to compare these triggers to better understand the difference between anxiety and panic attacks. While the triggers for anxiety can be more predictable and related to specific situations, the triggers for panic often seem to come out of nowhere, which can make the experience even more frightening. Understanding these causes and triggers is the first step towards learning how to manage anxiety and panic attacks. Difference 4. Physical symptoms. They can be frightening, but understanding what's happening to us is the first step in dealing with them. So, the physical symptoms of anxiety can include things like a racing heart, sweating, trembling, muscle tension, chest pain, headaches, and even gastrointestinal issues, such as stomach pain or diarrhea. It's as if our body is constantly on high alert, prepared to face a threat that often isn't even real. Now, when we talk about the physical symptoms of panic, they tend to be more intense and sudden. It can include things like shortness of breath, rapid heartbeat, palpitations, dizziness, trembling, a feeling of choking, cold sweats, nausea, and even a sense of depersonalization, as if you were outside your own body. The main difference here is the intensity and the rapid onset of these symptoms. While in anxiety, the symptoms may develop gradually and be more persistent over time, in panic they seem to emerge suddenly, hitting hard and often reaching a peak within minutes. These differences are significant because they can help in identifying the problem and in developing appropriate coping strategies. For example, if I know I'm experiencing symptoms of anxiety, I might try relaxation techniques or seek emotional support to deal with the underlying stress. But if I am having a panic attack, I may need more immediate interventions like breathing techniques to calm my body and mind quickly. Understanding these distinctions helps us address our mental health more effectively and seek the necessary support when we need it. Difference 3. Psychological symptoms. These mental aspects can be as challenging as the physical symptoms, but understanding how they manifest can help us better cope with these issues. So, when it comes to anxiety, the psychological impact can be quite broad. We may feel constantly worried, nervous, or tense, even when there's no apparent reason for it. We might also have difficulty concentrating, feel a sense of unreality or depersonalization, and even have catastrophic thoughts about the future. For example, I might be constantly worried about things like work, relationships, or health, even though there's no immediate threat. Now, when we discuss the psychological characteristics of a panic attack, they tend to be more intense and frightening. We may experience an overwhelming fear of dying, going crazy, or losing control. Additionally, we might feel a disconnection from reality, as if we're in a dream or watching ourselves from outside our own body. For instance, I could have a panic attack during a work meeting and feel as though I'm completely losing control of the situation. Comparing these psychological symptoms, we see that although both involve worries and fears, in panic these feelings reach a more extreme level and can be accompanied by an even more intense sense of unreality. These differences have a significant impact on the treatment and management of these issues. For example, while cognitive behavioral therapy might be effective in dealing with the negative thought patterns associated with anxiety, exposure techniques might be more useful in confronting the specific fears triggered by panic attacks. Understanding these differences helps to tailor our treatment plan and develop strategies that are more effective for our individual needs. Difference 2: duration and intensity. These aspects are important for us to understand the severity and impact of these issues on our lives. First, anxiety can be something we feel over long periods of time. For example, I might feel anxious for days, weeks, or even months, especially if I'm dealing with chronic stress or underlying issues. It's as if this state of constant worry becomes a part of my daily life, affecting my ability to function normally. Now, when it comes to panic attacks, the duration is usually shorter, but the intensity is much higher. A panic attack might last only a few minutes, but during that time, I can feel as if I'm on the verge of a total collapse. The sensation of terror and despair can be overwhelming, making it difficult to think clearly or act rationally. Comparing the intensity and duration between anxiety and panic, we see that while anxiety can be more persistent and of lower intensity over time, panic attacks are sudden bursts of extreme intensity that quickly subside. This difference has important implications for diagnosis and treatment. For example, someone who experiences frequent and intense panic attacks might be diagnosed with panic disorder, while those with chronic anxiety may receive a diagnosis of generalized anxiety disorder. Moreover, treatments may vary depending on the severity and nature of the symptoms. Difference 1: treatment and management. When it comes to anxiety, there are several common treatment approaches. One of them is cognitive behavioral therapy, CBT, which helps to identify and modify negative thought patterns that contribute to anxiety. For example, a therapist can help me recognize when I'm having distorted thoughts and teach me techniques to challenge them. Besides therapy, there are also medication options such as antidepressants or anxiolytics, which can help control anxiety symptoms. And of course, we cannot forget about self-care strategies, such as regular physical exercise, meditation, deep breathing, and a balanced diet, which can be crucial for maintaining our mental health. Now, when talking about specific treatment for panic attacks, the strategies can be a bit different. Breathing and relaxation techniques are often recommended to help calm the body during an attack. For example, I can learn to breathe deeply through my diaphragm to reduce the intensity of physical symptoms. Furthermore, gradual exposure to situations that trigger panic attacks, known as exposure therapy, can also be effective. For example, if I'm afraid of crowded places, I can work with a therapist to gradually face this fear, starting with less challenging situations and progressing as I feel more comfortable. Therefore, it's important to work in collaboration with mental health professionals to develop a treatment plan tailored to our individual needs. With support, understanding, and the right strategies, we can learn to manage our symptoms and live a fuller and more rewarding life. We can also explore prevention and coping strategies for anxiety and panic attacks together. It's important to have these tools in our arsenal to face the challenges that arise in our day-to-day life. Firstly, when it comes to anxiety, there are various prevention and coping techniques that can help reduce symptoms and deal with stress. One of my favorites is the practice of mindfulness, which involves focusing on the present moment and accepting our thoughts and feelings without judgment. For example, I can practice mindfulness through daily meditation or simply by paying attention to my senses while taking a walk. Moreover, regular physical exercise is a great way to reduce anxiety. Movement releases endorphins, brain chemicals that help improve mood and reduce stress. So, taking a walk, running, swimming, or practicing yoga regularly can be incredibly beneficial. Now, when it comes to preventing panic attacks, one of the main strategies is to identify and avoid known triggers whenever possible. For example, if I know that crowded places trigger my panic attacks, I might try to avoid these environments or develop coping techniques to deal with them more effectively. Furthermore, learning breathing and relaxation techniques can be crucial for dealing with the symptoms of a panic attack when it occurs. For example, I can practice deep breathing or guided visualization to calm my body and mind during a moment of crisis. Comparing these coping strategies for anxiety and panic, we see that many of them overlap, such as the practice of mindfulness and regular physical exercise. However, specific coping techniques for panic attacks, like identifying triggers and breathing techniques, can be especially important for avoiding and dealing with these intense episodes. Therefore, it's important to try out different strategies and find out what works best for us as individuals. With practice and persistence, we can develop a set of coping skills that will help us face the challenges of anxiety and panic attacks more effectively. I'm Dr. Anxiety, and I'm here to support you on your journey of self-care and personal growth.